All right, you are specially welcome to our today's edition of our daily health tip. Today is the day 7 of our daily health tip, and I want to welcome you specially. Just in case you're a new person to this platform, don't forget to hit the subscribe button. Please help us turn on the notification button, like, share, and comment as well where this video blesses you. Once again, you are specially welcome. I'm so sorry for the little break we had because of some technical issues, especially the light issues we are currently facing in this part of the country. So apologies for not being consistent as we promised to be. And nevertheless, we are here today on day 7 of our daily health tip, and today we are talking about something very, very important, and it is necessary we listen attentively so we would be protected against this infection called HIV. Just like I noted in one of my videos, HIV, the new cases of HIV is increasing day by day. Virtually every day we see new cases of HIV, and then you go out there, you don't see people that look as though they have HIV because the drugs we are giving them is doing well. The drugs we're giving them, they are doing marvelously well, and then you would hardly know anybody that is with this infection called HIV, and that's why it's necessary to enlighten the public on the possible ways, the possible means of preventing themselves from coming down with this infection called HIV. And just like I noted in my last video, I said there are many ways of preventing oneself with HIV. I will not bore you with several other ways, but then I want to concentrate on what we have today. As time progresses, we'll bring other ways along the path. Last time we talked about post-exposure prophylaxis, in HIV management, and just like we said, post-exposure is for people that have been exposed. Yes, people have been exposed to potential risk of acquiring this HIV, and then they are having to protect themselves. And we noted that the people that are supposed to do this are people that are maybe sexually assaulted, in case of rape, people working in the hospital, the needle that you use for a HIV positive patient mistakenly pricks you, and then you are having to report that about should I come down with HIV or not. We describe the ways that you would take to prevent yourself from coming down with HIV. I want to encourage you to go to that video, post-exposure prophylaxis in HIV infection. It will help you to know what you're supposed to do to better prevent yourself in case you are exposed. But then we're not talking about today. What if you are not exposed but you are at risk of acquiring this HIV? What would you do? Now, look at the categories of persons we are looking at here that are at most at risk of acquiring HIV. They are not yet exposed, but then they are at risk of acquiring HIV. What would you do? What are you supposed to do? Because you are at risk, you are most likely going to be exposed to the risk of acquiring this HIV. What should you do beforehand so that you will not come down with HIV? Now, let me bring the message home. For example, you are negative, you don't have HIV, but then your partner has HIV. What would you do to prevent yourself from coming down with HIV, especially when your spouse is diagnosed on this infection newly, and then the virus in the body of your partner is so high? What would you do to prevent yourself from coming down with HIV? Now, the other categories of people too, men that sleep with men, these persons too are at high risk of coming down with HIV. And there's people we call injection drug users. You see people that are addicted to drugs. They share several injections. One injection, many persons can share one injection, and then you realize that the same injection that somebody that may be positive used is the same injection, or the same needle rather, that the person used is what someone that is negative is also using. So the person is exposed to a greater risk of having HIV. We also see commercial sex workers too. These people are at risk because they sleep with a lot of persons, and then they virtually don't know the status of the person that they sleep with, and it is necessary that this group of persons find a way to get themselves protected from this infection called HIV. And then there is an organized system that have accommodated this group of persons so that they will not come down with HIV. And this program is what we call PrEP. PrEP, the full name is pre-exposure prophylaxis, in HIV infection. So we are looking at pre-exposure prophylaxis. Now, when we talk about pre-exposure prophylaxis, what are we talking about here? What do we mean? Pre-exposure prophylaxis is simply, the use of anti-HIV drugs. That's the use of ARVs, the use of HIV drugs, however you call it, to prevent HIV infection by HIV negative persons at risk or at high risk of coming down with HIV. So you need to look at my definition very well. These drugs are HIV drugs. Yes, normally the HIV drugs, majorly they are combination of two molecules, that are used to target to manage people that have HIV. I will not bore you with the drugs that we use for this to this effect because of abuse. When you say one or two, now people will be going to abuse it. When you want to sleep around, they begin. No, we don't want to bore you with that. So it's a drug. That's what you need to understand. And these drugs are used normally for HIV positive patients. But majorly if it's a HIV positive patients, the drugs must be three combination. But this time around we are using two molecules. It's not the scope of this video, but I want to understand that the same drugs these persons use, are the same drugs that people that are HIV positive still use, so that in case you see somebody, taking such drugs, before you suspect or raise alarm that this person has HIV, for people that prognose on what doesn't concern them, for you to do that, you need to understand first of all whether this person is taking it for, prophylactic purposes or whether this person is actually positive. So first of all, these drugs are used against HIV. That is one. Secondly, you need to understand that these drugs, people that will say taking PrEP, are people that are HIV negative. If you are HIV positive, they will place you on a lifelong treatment. That is the ARV drug, place you on it for a lifetime, as long as we wait for the innovation of a drug that will definitely take care of this infection. But as far as now is concerned, these people are being managed for a lifelong. So as long as you are negative, these categories of persons I've mentioned earlier, if any of them is found to be positive, then this person is no longer taking PrEP or taking HIV drugs, placed on ART. So in my definition, you see that it is taken by HIV negative people. So this person must be HIV negative before PrEP is commenced on them. Thirdly, these persons tend to be at risk of HIV infection. They are at risk of HIV infection, and I've mentioned people that are at very high risk of HIV infection. Virtual HIV majorly is transmitted through sex. People that are married, the sex is one of the major components of marriage. And so it is any person that is maybe your spouse is negative, so your spouse is positive and you're negative, you're already at risk, because this sex is what people do as a lifestyle. So you are already at risk, especially when the viral load of your partner is very high. So you need to understand that you are at risk. So I also mentioned injection drug users, men that sleep with men, people that have multiple sex partners, people that inject drugs, injection drug users, sexual, commercial sex workers, so this group of persons are at risk. So you need to understand the terms used in the definition. Now, if you are somebody who asks how well does PrEP work in preventing HIV, so there's something that's written here. It says studies have been shown that PrEP reduces the risk of getting HIV from sex by more than 90%. When used consistently. These drugs are taken one on a daily basis. So when used consistently, when used very well, when adhered to the instruction given to you the proper way it should be taken, this works perfectly. Over 90% for sex is recorded in preventing HIV. I would also want to say that these things are better combined with several other preventive mechanisms like use of condom, and all that. So, PrEP on its own accounts for over 90% assurance that you are going to be protected from having HIV. And someone would also ask, how safe is PrEP? PrEP has been shown to be safe. Let me just read what is they say. In previous studies, no serious side effects have been observed. So PrEP can cause side effects like nausea, in some people, but these generally subside over time. So if you are taking PrEP, tell your healthcare worker about any side effects that are serious or do not go away. So you need to understand that this drug is safe. That's the first thing I want to understand. Clinical test has been carried along, clinical trials have been carried along, tests have been done, to ascertain its safety. These drugs are safe, so they are safe, and they don't have serious side effects, just like you had, just minor side effects like nausea. And then if probably the cause of taking these drugs, because maybe individuals may have differences, and then there is a serious side effect you observe that is not going, as soon as possible, you need to report back to your caregiver, so that your healthcare provider, so as to tell you the next line of action. So I think if we do this thing very well, we can do well to protect ourselves from coming down with this illness. The truth of the matter is that it's not easy on HIV positive patients taking these drugs on a daily basis for a lifetime. So if there are ways and means whereby one can protect himself from this infection, it is necessary that we propagate this, that we tell people about it, that we educate people about it, that we preach this good news, so that people would be well, educated, so that they will protect themselves from coming down with this infection. So please, one of the best things you will do for us and to your friends and to people is to share this video, share it massively to whatever platform, so that people would learn this basic fact and protect themselves from coming down with this infection called HIV. Please, in case you're new to this platform and you've not subscribed to our channel, what are you waiting for? We do, plead with you to help us grow on this platform by clicking that subscribe button. Also help us to turn on the notification bell, so you would always be notified when we post any of our videos. Thank you so much, as we wish to see you, tomorrow possibly, as God keeps us alive for our day 8 of our daily health tips. Thank you so much. See you next time.